come into our Cardio Wellness Center about plaque and how plaque develops and how we can stabilize plaque just by getting risk factors and through diet and lifestyle, getting risk factors controlled and through diet and lifestyle. You know, it seems like for years we thought that plaque would slowly grow until it blocked blood flow to the heart, but we actually know plaque works a lot like a zit. Before a zit bursts, it's red, inflamed, and festers. There's a thin layer of skin over it, and it'll burst into the atmosphere. And that's actually what happens with plaque. Once you have plaque, if you don't get your risk factors under control, whether that's blood pressure, high cholesterol, high sugar, stress, smoking, being overweight, if we don't get risk factors under control, the plaque will be red, inflamed, and agitated. And if we don't build a thick cap over the plaque, it's easy for it to burst. So when it bursts, it's either sudden death or a sudden heart attack, depending upon how much plaque it blocks to the rest of the heart. It's interesting because we have learned that the majority of heart attacks occur in plaque that are less than 50% blocking blood flow to the heart. So the key thing is to find out if you have plaque, find out early, and then do everything you can to stabilize your plaque. The next two slides are cadaver arteries. So this white portion here is the actual artery, and here is a thin cap that was once attached. We didn't get risk factors under control. The plaque burst through. The cap was thin. And here's another one. So if we could have walled off the plaque at this point, it wouldn't have been such an issue. There's several linings in the artery wall, and one of them is filled with smooth muscle cells. These smooth muscle cells will migrate around and form a thick cap over the plaque, and it does so when we do aerobic exercise, so when we walk, cycle, hike, or swim. What eats away at the cap are risk factors that aren't controlled. So it really is important to find out early if you have plaque, exercise on a daily basis, and get risk factors under control to help stabilize plaque. And a man that weighs about 150, 160 pounds, he has 1,000 meters squared of vasculature. When we put a stent in that man, we're only treating 1/5,000,000th of the vasculature. But when we treat risk factors and eat healthy and exercise on a daily basis, we're treating 100% of the vasculature. And don't get me wrong, when you have crushing chest pain and you come to the emergency room, you know, opening that artery is what's going to save your life. But for long-term care of your arteries, it's truly about exercise and risk factor management, because we're only as old as our arterial age is. It is a whole new world out there. We are learning more and more people are learning early that they have heart disease. In fact, we consider it a medical failure if someone comes into the cath lab and that's the first they've heard of having plaque in their heart arteries. There's much that we can do today non-invasively to determine if there's plaque in your heart. This is a CT scanner. Actually, you just need to wear a button-down shirt, because we do put EKG patches on your chest to get your heart in the resting phase. Put your hands above your head, and they slide you into the CT scanner, and it'll shoot laser light beams around your heart for about 20 to 30 seconds. You're maybe on the table 10 minutes, and it takes about 15 minutes to process the results, and it will tell us if you've got hard calcified plaque in your heart arteries. Now, I would check around in your areas. I know here in Kansas City, where I work with St. Luke's Cardiovascular Consultants, they offer the test for $50. So my rule of thumb is if you're over the age of 40 with a risk factor, particularly family history of premature heart disease, I recommend finding out if you have hard plaque in your arteries and how aggressive we need to be with your risk factors. For the rest of the program, I'm just going to talk to you about risks. We'll talk about sugar and cholesterol and high blood pressure. I think a lot of people, however, will still treat risk factors in silos. Like, I got high sugar and we'll treat this, and I have high blood pressure and we'll treat this, and I have high cholesterol and we'll treat this. But really, if you have those three risk factors, it's a significant increased risk for heart disease. It's just not a threefold increased risk for heart disease. So, like, I have patients sometimes that come into the wellness clinic that say, oh, my sugar's up because it's the holidays or because of just what I had yesterday. My blood pressure's up, but it's because I ran in here today or I had a stressful phone call. And then my cholesterol's up because I've been eating bad the past 5 weeks, but I can change that. And they think they're at minimal risk. But when you put those three risks together, it's a huge risk. In fact, just being glucose intolerant, so having a little bit high sugar and not yet diabetic, you have almost a twofold increased risk of heart disease just by being glucose intolerant. And if you look at these next slides, I'm going to take you through 1985 to 2006 with obesity trends in the United States, because glucose intolerance and type 2 diabetes and obesity really go hand in hand. In fact, the majority of type 2 diabetics can be prevented through diet and exercise. We used to say that type 2 diabetics was more for people in their 70s or so when they let themselves go, when they quit exercising, gained weight, and didn't eat so heart healthy. But now we're finding it in people, or in kids, even in schools. So we do need to change our habits. But this is the obesity trends here in 1985. The highest percent of obesity in some states was 10 to 14%. We can see in 1991, it's some states with 15 to 19% of obesity. And we see in 1997 some states that have greater than 20% obesity. We see in 2001 some states with greater than 25% obesity. And now we see 2005, 2006, some states gaining greater than 30% of their population with obesity. It's amazing how fast it's growing. In fact, I just got a newsletter about Missouri is the 11th obese state in the United States so far. So we're number 11 for Missouri. So we have our work cut out for us on what we can do, which we can do a lot through diet and exercise. What's sad is that the kids in our grade schools will be the first that we bury as adults. Will outlive them because they don't know any other way but eating sugary food, out of control portion sizes. So we need to be better role models for them, and if we don't change what we're doing, we will outlive them. So it's important that we make that change in our lives just to help our offsprings and the younger generation, as well as to add quality to our life. And what we'll go over today not only helps to prevent heart disease, but it'll add quality to your life. It'll help prevent dementia and some cancers. So I really love what I do in our wellness center because it's not just about preventing heart disease. It's so much more. The United States is leading the obesity epidemic. And for years we thought that fat cells were storage depots. They were just inactive storage depots, and the fat sat in these storage depots and didn't do anything. But what we're finding out is that the fat in the abdomen is highly active. So not all fat cells are created equal. The fats in our abdomen are highly active. In fact, they work against us. This is a confusing slide, but really all you need to take from it is that the fat secretes a bunch of things that lead to deterioration of our health. This increase in angiotensinogen constricts your arteries and leads to high blood pressure. Increase in free fatty acids and insulin leads to insulin resistance, type 2 diabetes, and high cholesterol. These are clotting markers. So you increase the resistin and the PI1, you have increased clots. These are all inflammation markers. You increase inflammation markers, you have asthma and arthritis, and you increase the lactate and inflammation markers. It also leads to type 2 diabetes. So the fat cells in our abdomen is working against us, highly active, and these are the organs that those fat cells will attack. They'll attack our lungs through asthma and obstructive sleep apnea, attack our liver through having what we call a fatty liver or a non-alcoholic fatty liver, which is inflammation of the liver. That if that inflammation scars, you have cirrhosis. It'll attack our gallbladder. It'll cause abnormal menses, infertility, and the polycystic ovarian syndrome. Leads to gout, osteoarthritis, can cause inflammation of our veins, can lead to some cancers, can cause inflammation of the pancreas, can lead to heart disease, as well as can lead to strokes and cataracts. So we have abdominal obesity. We have really a huge problem with multiple risk factors with many of our organs just by having abdominal obesity. So it's really important that we know what our waist circumference is and we achieve the ideal weight. It's interesting that the causes of death in the United States are going to, our poor diet and inactivity patterns will exceed the death rate that tobacco has caused unless we change what we're currently doing. I don't know if you guys have seen this out or not. Hopefully not, but it's a quad stacker. So that's 4 beef patties, 4 pieces of cheese, 4 slices of bacon, and 4 squirts of mayonnaise. And this is, again, what our kids are thinking is serving size. I always look at the Chipotle burrito. Often kids are thinking that's the serving size of their burrito. And for those of you probably 40 and over, if you would look back at the Chipotle burrito and if that was placed on your dinner table 30 years ago, how many people would that have fed in your family? So I do think that we've gone way out of control with portion sizes. In fact, Dr. Vogel, he did this study, and you can actually, I have it on my blog, but there's a video actually of this where it showed that the blood flow was really sluggish, and you can hear the sluggishness of the blood flow through the arteries. But what he did is he took the blood flow at baseline through someone's forearm, and then 4 hours after their high-fat meal, quad stacker, fries, shake, you see the blood flow is even less than half of what it was at baseline. And then 6 hours later, it's not even back to baseline after the high-fat meal. So, you know, high-fat meals will do what cigarettes do to your arteries. It will constrict them, and it will damage them. So if we were going to take a giraffe and bring it to the Kansas City Zoo, we would put it in its natural habitat. We would feed it what it is genetically designed to eat because we want it to what? Live long, get along with others, play nice, and have a successful life at the Kansas City Zoo. But if we took that giraffe and we took it by McDonald's and did what we do to our bodies, that giraffe would have the same problems that we Americans have because we're not eating what we're genetically designed to eat. Now, we might laugh at this giraffe, but we all know of dogs and cats that are in this category. And I often say if your dog's overweight, either you're not getting enough exercise or you're not eating the right foods. So it is really important that we do what we're genetically designed to do. We exercise every day, and we eat lean proteins and fruits and vegetables. It's interesting that if you just have 3 risk factors, you increase your risk of heart death, okay, cardiovascular mortality, by 3.5-fold, just if you have 3 risk factors versus none of those risk factors. So there's a lot that we can do, and all those risk factors, what I'm talking about would be waist circumference, good cholesterol being too low, bad cholesterol being too high, high blood pressure, and your sugar being too high. All of those are modifiable risk factors. So if you want to reduce your risk of death, we got to get risk factors under control. I'll talk first about sugars. Normal blood sugar is less than 100, fasting blood sugar. People are pre-diabetic if they have a blood sugar between 100 to 125. And oftentimes your primary care provider won't even say you're in the pre-diabetic category. But if you are above 100 and below 126, you are in the pre-diabetic category. And what that says, if you continue to do what you're currently doing, you're going to have diabetes. So it really is important that you know what your fasting blood sugar number is, not just let someone tell you you're okay, but to know what the number is and do what you can to change that. The fasting blood sugar is just the last 24 hours of simple carbs and simple sugars that you consume. If you have 2 sugars of 126 or greater, that gives you diabetes. So it does make a difference if you're sitting at 124 versus if you're sitting at 99. So it is important to know what your numbers are. And it's good to compare what your numbers are. When people come into our wellness center, we always have their prior numbers, and then we have the most current numbers for them to look at on the same page. So right now it's interesting because we are comparing August, September numbers with their, let's say, April, May numbers coming out of the winter. So their HDL is usually up because they're doing more exercise. LDLs are coming down because they're doing more exercise or eating more fruits and vegetables, so they can tell the difference of what happens in their life. Now, if some people are coming back from a cruise or vacation, they can see that difference as well and what they need to do to offset that, exercise more or cut back on carbs and sugars. So how do you prevent diabetes? Again, it's cutting back on simple carbs and sugars in your diet. It's increasing your exercise. We recommend 30 to 45 minutes of aerobic activity most days of the week, but I tell my patients if they're not doing anything at all, I want them to walk 10 minutes a day for the purpose of exercise. And the reason for that, that's not going to get them cardiovascular fit, but what that's going to do is start making it a priority in their life. I mean, they won't negotiate 10 minutes with me because my comment back to them is, you're telling me to cut back from 10 minutes. We all can do 10 minutes. But what it does is, again, it starts to make it a priority in their life. When are they going to get the 10 minutes in? And then we'll go from there. But that's the important thing, is to make it a priority in your life and then start adding to it. And if you're overweight, if you could lose 5 or 10 pounds just through increasing your activity, decreasing your simple carbs and sugars, that'll also help prevent diabetes in your life. Talked a little bit about waist circumference already, because we know the abdominal fat leads to poor outcomes and poor health. So an easy way to remember what your waist circumference should be would be your waist circumference should be half your height in inches. So if you are 70 inches tall, your waist circumference should be 35 inches or less. And we measure it from the top of the hip bone to what goes to the door first to the top of the hip bone. That's what you measure. So I have a lot of men that will say, oh, my pant size is 44 inches or 40 inches. I don't know how she got 44 inches for a waist circumference. We don't measure under the belly. We measure what goes to the door first. So remember that. If you're of Asian descent, there's a different chart that we go by because the Asians have smaller hips. And we just want to make sure that we avoid the abdominal fat because it does lead to poor health. Next, I'm going to talk to you about cholesterol. Just by having high cholesterol, that's almost a 2.5-fold increased risk for heart disease, just by having high cholesterol alone. And again, it's important to know your numbers, and it's important to compare your numbers. I had a nurse the other day that came up to me, and she goes, Becky, I always know when I have someone that's seen in the wellness clinic because they know their numbers and they know what it means, versus somebody that just calls in and says, well, I don't know, but I was told they were good, or I was told I was borderline. But you do need to know your numbers because there's a range of where your numbers could be. If you're bad cholesterol, you want less than 70, and one day you're at 50 and the next day you're at 74, that tells you that you've eaten a lot more bad fats. So it is important to know your numbers and compare them. So your good cholesterol is your HDL, your high density lipoprotein. The more of this, the better. In men, we like this above 45, and in women, we like it above 55. And again, the more of this, the more heart protective you are. Studies do show that people with low HDL have increased risk for heart disease. Your LDL is your low density lipoprotein. I think it's low, it's bad, you want less of it. It's your bad cholesterol. If you have heart disease, diabetes, aneurysm, kidney disease, carotid artery disease, you'll want this below 70. If you have 2 or more risk factors for heart disease, you'll want it less than 100. If you have 1 risk factor for heart disease, the guidelines will say less than 160. I still think if you're around 160, you're pretty high. I would do some over-the-counter supplements, diet, and lifestyle changes just to see if you couldn't get it down a little bit lower than that. Triglycerides, national guidelines will say less than 150 for triglycerides. Triglycerides, all those are simple carbs and sugars that you've consumed 3 or 4 days before the test. That's all the triglycerides are. So we'll go into this in a little further detail. There is an equation for cholesterol. In fact, if you get your cholesterol numbers, your total cholesterol should equal what your good cholesterol is, your HDL, plus your bad cholesterol, your LDL, plus triglycerides, but they're divided by 5 before they're added into the good and bad cholesterol. If your triglycerides are over 200, 250, that becomes inaccurate, so you got to be careful about that. But I'll have patients will say, Becky, my total cholesterol is 200. Is that good or bad? And that really doesn't tell you anything. You really got to know what your HDL is, your LDL, and your triglycerides, because the total cholesterol is made of those 3 numbers. So here is an example of 2 people with total cholesterols of 200. Okay, and both of these people are a woman. So it's women who have 3 risk factors for heart disease. So in women, we want their HDL above what? 55. So the first value here, HDL of 80, this first line, HDL of 80, this first woman, that's a good cholesterol because we want it above 55 and it's 80. She's got 3 or more risk factors. We want this less than 100. She's 95. And triglycerides, we want below 150. So this first line person here is excellent. This next line is a woman that has 3 or more risk factors for heart disease. Her HDL is low. We want it up at 55. She's a woman, and it's 35. Her LDL with 3 or more risk factors, we want less than 100, and she's 127. And her triglycerides, we want below 150, and they're 190. So this second person here is significantly at risk. What's interesting is the same person. The first line is before menopause, and the second line is after menopause with no exercise. So we can, if you think you've been trucking along just fine and you don't think you need to check your cholesterol, I think it is important to get your cholesterol checked. And if you're making lifestyle changes, get it checked every 4-6 months, because it will definitely affect your cholesterol profile. 3 out of 4 American adults have bad cholesterol above 100. And it's interesting because it took us years to genetically change, 2.5 million years to genetically change. And then over the past 50 years, socially, we have been able to become the man in the recliner watching TV, ordering and eating food. We have actually learned how to push a button, have over 2,000 calories delivered to our doorstep and consumed without expending any energy whatsoever. Unfortunately, that's not what we're genetically designed to do, and that's why we look the way we do and we have the health issues the way we do. If we look at pockets throughout the world that still live a hunter-gatherer lifestyle, and we look at their total cholesterol, not their LDL, but their total cholesterol values, the HASDA's total cholesterol is 110, Pygmies 100, Inuit 140s. So if you just look at the people that live the way they're genetically designed to eat, their total cholesterol is normal. It's very low to us, but it's normal. Wild primates, total cholesterol 110 for the baboon, the monkeys 110 and 140. And then if we look at some animals that I would consider to have weight issues, that eat what they're genetically designed to eat off the land, the pig comes in with a total cholesterol. So this is, again, not LDL, but this is total cholesterol of 100. The rhino comes in at 90, the elephant 110, and the horse is 140. And if you look at what the adult American comes in, is an average of about 210 or 209. So again, if we can just live how we're genetically designed to live, lean proteins, fruit and vegetable, exercise every day, our cholesterol would be much better. So it's not that we recommend lower is better just because it's better. It's lower is normal. Lower is what we're supposed to normally be in our bodies. So if we want to prevent disease and heart disease, we need to learn how and to eat and exercise the way we're genetically designed to. So here's some ideas to lower your LDL cholesterol, your bad cholesterol, and we'll go over diet here in just a minute, but it's decreasing saturated fat and trans fats. It's increasing your exercise, 30 to 45 minutes most days of the week. If you don't exercise at all, start out by 10 minutes. If you're significantly overweight and you can't do 10 minutes of walking a day, I always say work up to 2 minutes twice a day. Because there's a statement that I've always kept in the back of my mind, is that if you quit doing the hard things, then the easy things will become hard. And so I think it's important, and I always tell patients it's not about where you've been, it's about where you're going. So if you can make any small lifestyle changes today, it'll affect your health for tomorrow, because yesterday's decisions affected your health today, but today's decisions will affect your health for tomorrow. And then, of course, there's prescription meds and supplements that will also help to lower your LDL cholesterol. So saturated fats, cheeses, dairy products, so milk other than skim, ice cream, marbled meats, poultry skin, sausages, bacon, those are all saturated fats, and they will work to raise your bad cholesterol. So you should limit the amount of these that you have. And trans fats are also going to raise your LDL cholesterol. Dr. O'Keefe and his wife, registered dietitian Joan O'Keefe, say that these are some of the worst foods on the planet in their Forever Young diet book. And these trans fats are baked goods such as cookies, cakes, pies, donuts, pastries, croissants, crackers, anything that comes in packages often are loaded with trans fats as well. So if you knock back on the saturated fats and trans fats, you'll improve your cholesterol. If you eat more of them, you'll increase your bad cholesterol, you'll reduce your good cholesterol, you'll increase your triglycerides, you cause damage to your arteries, and it will lead to plaque buildup. So your LDL, we want to see it below 70 if you have heart disease, diabetes, kidney disease, carotid artery disease, aneurysms. Want to see it below 100 if you have 2 or more risk factors for heart disease, and less than 130, 160 is the guidelines. Better to be below 130 if you have 1 risk factor for heart disease. There are supplements that I use for LDL cholesterol as well to lower LDL cholesterol. So the CardioTab supplements I use a lot. They're purified. Dr. O'Keefe and his panelists help to make the products. The CardioSterols and the CardioT are very good at reducing LDL cholesterol. On the CardioT, I get about a 10 to 15% reduction on the LDL cholesterol. It's powerful. It boosts your immune system. It helps to speed up your metabolism, and it helps to get rid of belly fat, and it has theanine for focus and clarity. So I'm a big believer in CardioT. CardioSterols, they're 2 capsules twice a day. Take with food. It helps to prevent the absorption of the cholesterol that you consume. They have a new product, is red yeast rice, and I recently did a study with the red yeast rice and their liquid fish oil, and I posted that on my blog at cardiowellness.blogspot.com. But there was a 28% reduction in LDL cholesterol, and I think a 22% reduction in triglycerides by taking the red yeast rice with the liquid fish oil. So and that's almost as good as some of your prescription medicines that are out there. So there are some excellent things we can do with supplements if you prefer to go with supplements or if you're unable to take prescription medicines. So triglycerides, all those are carbs and sugars 3 or 4 days before the test. And for everybody's triglycerides, we want below what? 150. So if I told you to go have 20 tablespoons of sugar, you would look at me like, I'm not going to do that, that's crazy, because you think it's bad for you and it doesn't appeal to you. But then if I said I had some sugar mixed in with some warm syrup that has cinnamon in it, mixed in with some warm bread that's heating up, you start to thinking, hey, that's not such a bad idea. So we do kind of need to retrain our brain as to what's good for us and what's not good for us. This might look delicious, but it's actually loaded with everything that's going to hurt our arteries and diminish our health. It's got over 700 calories, 114 grams of carbohydrates, and 24 grams of total fat. So we really need to be diligent with what we eat and what we consume and limit these simple carbs and sugars in our diet. 20 ounces of soda is 20 teaspoons of sugar. So I'll have patients that, I tell them they're addicted to sugar. They say, well, I'm not, I only have 1 soda a day. Well, if this is their 1 soda a day and they sip on it all day long, they're sipping on sugar to keep their sugar level pretty high so it won't dip down and they won't feel like they're going through sugar withdrawals. If we have 1 soda a day above what we would normally have, or if you added a soda a day and you didn't drink one, you would gain 17 pounds a year. You would increase your risk of obesity by 60%, and you would increase your risk of diabetes by 40%. So to lower your triglycerides, we need to cut back on simple carbs and sugars in our diet. In fact, if you get up and you have carbs and sugars for breakfast, whether it's 2 pieces of toast, orange juice, and a banana, all carbs and sugars, you're turning on your sugar addiction right away. If you have cereal loaded with carbs and sugars, you're turning on your sugar addiction right away. People will ask me what I think about Sweet Mo, Splenda, Equal, all the artificial sweeteners and diet sodas. And my comment back to them is, since those have come out, has the world gotten smaller or bigger? We've gotten more obese. So what happens is, it's not the calories that we're addicted to, it's the taste. So if we get up and have coffee with Splenda in it, or Equal or Sweet Low, or coffee with sugar in it, or a diet soda or a regular soda, we're turning on that addiction, that taste that we're addicted to. And every couple of hours, we have to feed that addiction, whether we grab a piece of popcorn here, a pretzel here, an M&M here, chocolate here, bread here, or we sip on more soda. We are actually having to deal with the addiction. The problem with the addiction is, in order to get through it over an addiction, you have to go through withdrawals. So you have to cut out carbs and sugars. And it takes about 10 to 14 days of going through the withdrawals before you're no longer addicted. But I strongly encourage patients to limit their simple carbs and sugars in their diet, because that's what's going to lower their triglycerides, increase their activity, and high-dose fish oil will lower triglycerides. So you need anywhere from 2 to 4 grams of fish oil. I like the extra strength CardioTab fish oil because 2 capsules is 1,100 of the DHA and EPA, or 1.1 grams. And so you just need to take 4 of those, of the extra strength fish oil for CardioTabs to lower triglycerides. They also have the most concentrated fish oil they have is the 1 teaspoon a day that gives you about 2,300 milligrams of DHA and EPA. So you can take 1 teaspoon a day as well to lower the triglycerides. This is a blood sample from one of my patients. This patient has triglycerides of about 700. And the blood in this first tube is from here to here, and triglycerides settled here. And this is part of the tube down here, but this is the blood from here all the way up here, and this is all the carbs and sugars and triglycerides here. And here's the blood from here to here, and then the carbs and sugars settled up here. It's interesting, you can kind of see the torque or the twist here. It's got to be when I flipped this tube over, it just kind of went clunk. It was very heavy and thick, and he was ultimately surprised. My technician knows when I have someone with high triglycerides to hand me their blood vials in front of them. I tape it to my computer, and at the end of the counseling session, I talk to them. I show them what their blood is on carbs and sugars, and they're amazed. So what is being pushed through this person's arteries and veins are all these carbs and sugars. And anything that nicks the artery wall, even normal cholesterol, can get into that nick and start to form plaque. So we got to make sure that we get rid of all these carbs and sugars so it's not putting so much garbage in our arteries and causing nicks in our artery walls, because we're only as old as our artery age, and we're only as good as our arteries are. So this person is really craving, his body is really craving fruits, vegetables, and antioxidants, and less carbs and sugars. The lab actually spun down, took the blood out and spun down the different triglycerides for me, and you can actually see how it goes from real clear and it starts to get cloudy, and more cloudy the higher the simple carbs and sugars are. So it is really important we cut back on simple carbs and sugars for our health. American Heart Association does recommend omega-3 fish oils. In fact, if you don't have heart disease, it just recommends you eat a variety of fish at least twice a week. And that's not catfish. Catfish is completely devoid of omega-3 fish oils, and it's not fried fish. So you want to do fish with high DHA and EPA, so salmon is a good fish, tuna. So it does recommend you have fish at least twice a week. If you have heart disease, it recommends that you have 1 gram or 1,000 milligrams of the EPA and DHA. And if you don't know what EPA and DHA is, if you look at your fish oils, so your fish oils or your omega-3 pills or your fish oil pills, on the bottle it might give you a total amount like 1,000 milligrams, but you need to flip the bottle around and you need to look at the label, and you need to look at how much DHA and EPA you're getting, because those omega-3s, those 2 omega-3s are what's so heart healthy. And you need to make sure that those 2 omega-3s, the DHA and EPA, adds up to 1,000 milligrams or a gram a day if you have heart disease. And if you have triglycerides, you need 2 to 4 grams or 2,000, 4,000 milligrams of the DHA and EPA to lower the triglycerides. And there is a test available. It's called the Omega-3 Index, and it will say if you're consuming the right amount of fish oils or eating the right amount of fish. And people that had an index, omega-3 index of 8% or greater, had an 80% reduction in cardiovascular disease. So we can do a lot just by consuming fish oils or eating the right amount of fish. Next, I'm going to talk to you about your HDL cholesterol. It's your good cholesterol. We can actually do a lot to modify HDL through diet and exercise. A lot of people say, you know, we're not really for sure where we should be on the HDL cholesterol. When you look at studies, the one is neutral. So if you are higher than 1, you have more risk for heart disease. If you're less than 1, you have less risk. So I always look for the neutral mark in studies. And the Framingham Offspring study is one of the biggest studies that all cardiologists the Framingham studies, all cardiologists use most of their guidelines from. So if you look at the neutral mark in men, the 1, it's an HDL of 45. And the higher up, the less risk you have. And the neutral mark in women, the 1 in women, is at 55. So all males, we want HDL above 45, and all females, HDL is above 55. HDL you can change significantly through diet and lifestyle. Now, there's a certain percent of the population, a very low percentage, but they're out there, that don't respond to exercise. They have an inherently low HDL and they don't respond to exercise. Now, you can have an inherently low HDL but still have a response to exercise. And so for those people, I tell them you're always going to have to exercise more than the average person to get your HDL up. So if you're walking 10 minutes a day and your HDL is around 40, you need to increase it to 20 minutes a day. To raise HDL, it can be through increasing your intensity. It could be through increasing the duration, how long you go for exercise, or it could be through increasing the frequency. If you're only going 3 days a week and you add 5 days a week to it, that would raise the HDL. If you're smoking, stop. That'll raise your HDL. Losing weight, if you need to, will also raise your HDL. Now, initially, when you change your lifestyle, if you do so drastically and you lose 15, 20 pounds and start exercising in about 3 months, the HDL will go down first before it comes up, but it will come up. And then over-the-counter vitamin B3, which is niacin or nicotinic acid, or the prescription form of that niacin, all will assist with HDL raising. You've got to be careful with that. It does cause a flushing cessation when you take it, so you need to be careful. But all these things raise HDL. We do know that in studies with people with low HDL, they have an increased risk for heart disease. So we can do a lot with diet and lifestyle change for HDL. And lastly, I'm going to talk to you about blood pressure. Just by having high blood pressure, you have a 1.5-fold increased risk for heart disease just by having high blood pressure alone. In fact, in the Lancet, in August of 2007, they were saying that the lifetime risk of getting hypertension for all of us exceeds 90%. So it's important that we know what our blood pressure numbers are. I have many patients that will say I had a stressful phone call, I raced here, traffic was bad. And it gives you many excuses on why their blood pressure is up. So I have a card that I give them, and I ask them to monitor their blood pressures at home twice a week and to call if it's consistently greater than 130/80. Because then they become a believer in, yeah, my blood pressure really is up. And oftentimes what I find is people don't want to take a medicine, and they don't feel the high blood pressure, and so that way they don't have to take a medicine because they don't feel it. It must not be hurting them. But over 90% of heart failure cases were precipitated by high blood pressure that was not controlled. So what we don't want to take one medicine for today, 5, 10, 15 years from now, we're going to end up taking 5 medicines to control heart failure. So it's really important that you know your blood pressure numbers and you get your blood pressure under control. And if its blood pressure is consistently greater than 130/80, I definitely recommend you follow up with your primary care provider to see what you can do to lower it. And there's lots of natural ways that you can lower your blood pressure. Why do we want the blood pressure lower? Not just because it's better, but because what? It's normal as well. If you look at Indians that live the hunter-gatherer lifestyle, both males and females and across all ages, okay, for males and females, the top number of their blood pressure is 90s to 100 for both males and females. And if you look at the bottom diastolic number, 50s to 60s in males to females. So the important thing here is lower is not just better, but it's normal, and that's what we need to get blood pressure under control. This study actually changed how I treated blood pressure in my clinic. When I read this study, these are slices of aorta from mice, and in this picture here, they gave mice healthy chow, and they looked for white plaque, calcified plaque growth. And so they gave them healthy chow, and they didn't see a lot of plaque growth. Then they gave them atherogenic diet, trans fats and saturated fats, and you start to see a little bit of plaque form in the aortas. And then here, they gave them a healthy chow, but they raised their blood pressure to 140/150, and you can see a little bit more plaque forming. But this is just huge. What they did here is that they gave them a trans fat diet, saturated fat diets, so all the bad things to eat, raised their blood pressure to 140/150, and look at the huge growth of plaque in the aorta. So I told myself if I was ever going to stop risks for heart disease and events, I got to get blood pressure under control as well as diet. So I've started being a lot more diligent, and that's when I started having everybody call me if their blood pressure is consistently greater than 130/80. In our wellness center last year, I completed 2,570 visits. 86% of those visits had people had heart disease, but we only had 7 events. And for the last 5 years, 90% of the patients with hypertension have been controlled. So I do think controlling blood pressure is a huge part, as well as diet and lifestyle. If you control blood pressure, you reduce your risk of a heart attack up to 25%, stroke up to 40%, and heart failure greater than 50% just by getting blood pressure controlled. And if we lower blood pressure just by 2 points, so if we lower blood pressure by 2 points, we actually prevent premature deaths by 7% and disabling strokes by 10%. And there's simple things we all can do to lower blood pressure just 2 points. Exercise, reduce our salt consumption, reduce stress. Weight loss if needed, even 10 pounds, you will reduce your blood pressure. Limit your alcohol drinks. And if you snore, you do need to discuss that with your healthcare provider, because snoring could be a sign of sleep apnea. If you can't sit on the couch very long with sedentary without falling asleep, if you wake up tired and unrefreshed, if you have witness spells by somebody that says you quit breathing when you're sleeping, all those things can lead to sleep apnea. And what happens is when you have sleep apnea, your arteries constrict and your blood pressure goes up. So definitely, if you have any of those signs or symptoms, follow up with your primary care provider. So what I hope you got out of the presentation is just when you have high sugar and high cholesterol and high blood pressure, it's just not a little increased risk for heart disease. If you have all those, it's a huge risk for heart disease. And that we do need to change our diet and lifestyle in order to optimize our health. Because even if I got someone's numbers all under control, but they were still overweight and didn't exercise, they're still at risk. And this was published actually in 2004. And basically, it says people who do all 4 of these FAB5 lifestyle longevity factors, they have a 2/3 lower risk of death than those who follow just 1 or more. And all it is exercise, don't smoke, healthy diet, so it's lean protein, fruits and vegetables, use olive oil, and limit your alcohol intake. And then if I had a pill that would make you lose weight, would give you self-confidence, lower your triglycerides, lower your bad cholesterol, your LDL, raise your good cholesterol, prevent diabetes, decrease your blood pressure. If you had peripheral vascular disease in your legs, it would build collaterals around those. It would reduce. Are we still on?
Yeah, we're still good.
Okay. It would reduce your risk of stroke. I don't have it on my screen anymore. Okay.
Bear with us 1 second.
Am I on?
Yes, Becky, you're good.
Let me get back on. I'm on.
Yes, yes,
Hello?
yes. Can you hear me? Becky?
Aaron, am I on?
Becky?
Aaron?
Can you hear me now?
Yeah, can you hear me?
Great, great, yeah.
Yeah, I'm not sure what's happening here. It just goes on. Okay, so you got exercise up? Can you
Right,
see my slides?
yes.
You can see it?
Get some form of aerobic exercise in each day of the week.
Right. So that's what we recommend because exercise decreases weight, decreases triglycerides, increases good cholesterol, decreases blood pressures, blood sugars, decreases heart rate, prevents clots. And in fact, when we used to do the morning commute years ago, we used to get rid of 300 calories. But today, actually, on the way into work, we're gaining it depending upon where we go for breakfast in the morning. So we do need to be diligent with our diet and lifestyle. I don't know, here in Kansas City, there's a mall up north where there's a DSW and they didn't even build the stairs. They actually just put an elevator between. So whenever you can be active, we need to be as active as possible. I know this next slide is pretty silly, but it's true. We've actually do everything we can to prevent from exercising. So what we need to do is we need to make sure we do get some type of exercise in every day, even if it's 30 minutes of walking. Actually, walking is the least aborted exercise, and if we can prevent walking, or if we can walk 30 minutes a day for the purpose of exercise, we can prevent heart disease up to 50% just by walking. So the next question I get is, so Becky, what should I eat? And if you look at your plate for breakfast, lunch, and dinner, and for snacks, you should have a lean protein and 2 colors, fruits and vegetables. So some ideas of lean protein, even for breakfast, have healthy nuts and a fruit and vegetable. Have leftover turkey, chicken, and fish. Have egg whites, all natural peanut butter, whey protein. All of those are lean proteins. And the more color on your plate, the better. You need to avoid some pastries and sugary foods, but the more lean protein and fruits and vegetables you have, the healthier you will be. So always rate your plate. The more color, the better. And then just this last couple of slides here is, I was reading this article in 2008 telling you how to be healthy, and it says to be as lean as possible within normal range of your body weight, be physically active as part of everyday life, limit consumption of energy-dense foods and avoid sugary drinks, eat foods of plant origin, limit red meat and processed meat, limit alcohol drinks, limit consumption of salt, and aim to meet your nutritional needs through diet alone. So don't take pills just to get your nutritional needs. You need to try to get it through diet alone. What was interesting is that the title of this article I was reading was Dietary Strategies for Preventing Cancer. So the things that we talked about today aren't only going to help you prevent heart disease, they're going to help you prevent cancer, dementia, and give you more quality of life. Our Cardio Wellness Center, we have a 3-step program in our Cardio Wellness Center, and we actually we do an initial risk assessment where we look at people's lab work, look at cholesterol, we look at sugar levels, We even might do an advanced lipid screen if we need to, vitamin D, inflammation markers, genetic markers, and we do a complete assessment of your blood pressure, and we just gather all the information. And the second step is we look at your specific needs and your specific risk areas that we need to make changes on. And then we develop a plan specifically for you that fits with your daily lifestyle and what we can do to help you to be healthy. And then the last step of it is we do a follow-up. So we see you back, you know, 20, 30 minutes, 3 to 4 times a year. So you can actually see how you've done or how you could improve when you compare to your prior values and where you were a year ago. And we continue to do that so you can be as healthy as you can throughout your life. We do have Wellness Wednesdays. We actually offer just a free risk appraisal. You see our cardiology nurse who can tell you if you have increased risks or not and if you need further follow-up. So it's a good thing to have for the community. If you don't have this in your community, talk to your primary care provider about going through specific risks, and that way you can set up and be healthy all year round and prevent heart disease in your life. This is where you can find us, and I appreciate you all joining in this afternoon, and I'll be available for questions.
Great presentation, Becky. You had wonderful graphics and fascinating stats. Sorry again for that technical difficulty. Not sure exactly what happened, but do you have about 10 minutes or so for questions and answers?
I do.
Great. Okay. Well, during the presentation, we polled if anyone had cholesterol questions, and Brad asked, my total cholesterol is 215. I'm 37 years old, and I exercise. My diet is very clean, but I'm wondering if I should be on a cholesterol-lowering medication.
Okay. It would really depend upon what the HDL, LDL, and triglycerides are. So if the HDL is low, that's more exercise and weight loss. If the LDL is high, so if you don't have risk factors and it's above 130, then I would definitely recommend perhaps a supplement, either the Cardio-T, Cardiosterols, or consult with your healthcare provider, perhaps red yeast rice if your LDL is high. If your triglycerides are high, I would definitely recommend cutting back on carbs and sugars and a high dose of fish oils to lower the triglycerides. But it would depend more on what each individual HDL, LDL, and triglyceride levels are.
Gotcha. One question that we've heard a bit, and it's a common question asked, is what are your recommendations for eggs for people with and without high cholesterol?
Well, you know, the egg yolks is the egg whites is the healthy part of the egg. It's the lean protein. So that's why we like egg beaters, because they're just egg whites. It's not that you don't have to have any yolks. You know, you can limit yourself to 4 or 5 egg yolks a week. If you like scrambled eggs, have 1 egg yolk and a bunch of egg whites with it. But the key is to limit. Everything is in moderation. So I wouldn't go over 4 or 5 egg yolks a week. But egg whites is the lean protein. The yolk in the egg has tons of cholesterol, so you just got to be really careful with how much you have of it.
I see. What are your thoughts on flaxseed? Is it helpful for reducing LDL?
You know, flaxseed and fish oil don't really work to lower LDL cholesterol. In fact, I mean, flaxseed is a healthy, seed that you can put in salads and in your food, but it takes a lot of flaxseed just to make 1 DHA molecule. You're much better off having fish oil than you are having flaxseed. And no, flaxseed's not going to lower LDL cholesterol.
Gotcha. A question from the audience, from Daniel. His total cholesterol is 190, HDL is 47, LDL 115, triglycerides 130. He takes 500 milligrams of niacin over the counter twice a day, has increased fiber intake, and is wondering what he can do to decrease his LDL, and should he be worried about his triglycerides. He had a cardio scan with a score of 0.
Well, that's great. Your cardio scan score is 0, which that means you have no hard plaque. Does not mean that you don't have soft plaque there, but it means you have no hard plaque, which is excellent. HDL is good. And since you don't have any hard plaque, your LDL is okay. You don't have to do anything further with that. Triglycerides, you tend to like carbs and sugars, even though you're below the national guideline of less than 150. When you're above 100, I kind of know that you really like carbs and sugars. Niacin is a good over-the-counter supplement. It really is. You need to get immediate release niacin. The flush-free niacin does nothing for you. In fact, it can raise liver enzymes. So you want to stay away from flush-free niacin. But if you want to take immediate release niacin, that's great. To further lower your triglycerides would be cutting back on carbs and sugars, exercise, weight loss, and or increasing your niacin. And as you increase the niacin, that will lower the LDL a little bit more too. So if you if you increased your exercise or if you lost weight, that would lower the LDL a little bit more too. Another thing you can do for LDL lowering is you could do the cardio T, and that will also get some triglyceride reduction. And red yeast rice, the CardioTab's red yeast rice will also lower the LDL and triglycerides for you as well. So all those things would be beneficial.
Great, great. Do you know whether LDL levels naturally rise a bit as we age?
You know, no. I mean, you can see in people that live off the land and what they're genetically designed to do, they don't naturally rise. It's just we naturally get lazy as we get older. We don't eat as healthy and we don't exercise as much, and so LDLs are going up. But the key to keeping a normal LDL is doing what we're genetically designed to do. Lean protein, eating lean protein, fruits and vegetables, staying away from processed sugary foods, and exercise.
Gotcha. Another question from our poll: does Metamucil help in reducing LDL? Cardio T or Metamucil, which one is better?
That's a good question. I don't know exactly which one's better. Metamucil is a lot of fiber, and one heaping spoon of Metamucil and 10, 12 ounces of water, helps to fill you up, gives you plenty of fiber, and will bring down your LDL some. If you're looking, I mean, that's just to fill you up and to prevent you from eating bad fats and stuff. So I think that's healthy, and it gives you plenty of fiber. So they work completely different. Cardio T, you're going to get about a 10 to 15% reduction, so I think you'll get a little bit more percent reduction in the Cardio T, but it depends on how much bad fat.
Becky? One second, folks. Experiencing some more technical difficulties. Well, maybe Becky had a bad connection on her end. So this webinar was recorded, and we will be emailing that to you shortly. Thank you again for attending CardioTab's Cholesterol Health webinar, and we look forward to answering your health and nutrition questions again. The questions you have submitted already, we will email you back with appropriate answer. Thank you again for attending. Have a good day.